Hi. So now we are going to discuss the next topic, which is that how injury can occur in an athlete while practicing. So number one criteria is the age. So I'm going to give you an example that if you are practicing at your home and your age is, say you are 22 years old and you are going to choose your partner for your practice. For example, in a judo, if you're choosing your partner of a 32-year age and you are younger, 10 years younger than them, so and they are more in weight, so there are susceptible chances to get an injury, because if you are playing with a above age person or above weight person, you are not in that category, so there are chances that during the fall or during playing or during conducting those exercises or doing performing over there, you are susceptible to have some injuries. So I request you to avoid this thing. Number two, you have to avoid any kind of aggressive or a violent kind of a behavior. For example, if you are a boxer and you are practicing at your home and you wanted to do some dry run kind of a thing at your home, and if you are choosing a partner who's aggressive and violent, so certainly he or she is going to conduct or behave in a different way, aggressive way, and you may be able to get some injury. So you have to avoid the aggressive and violent kind of a behavior kind of a participant or a colleague in such kind of a game. And next is avoid the drug abuse and the alcohol, which can also cause certain kind of a injury. And finally, if any athlete will be having underlying kind of bone and a joint deformity, this can also cause a sports injury while performing or during the exercise. Well, the next point is how the rest of the world, the sports authorities, they have taken care to just restart the games in the stadiums, indoor as well as the outdoor. They have started in the phasic manner. In phase 1, they call small group of elite athletes so that they can maintain the social distancing, that 1.5 meter among the athletes, and they are practicing in the open fields so that there should be no suffocation kind of a thing, and they can openly perform their activities in the open field. And in phase 2, they call a big group of the athletes, means more number in a number of athletes they call, so that gradually they enhance it, and vis-a-vis the all precautions which are mandatory at phase 1 and phase 2 are they do not share any equipment, they should not share any water bottles kind of a thing, and maintain the personal hygiene like mask, higher sanitizing, social distancing kind of a thing. But in phase 3, they are allowed to touch the ball, to share just like a tennis ball or a football or a rugby ball kind of a thing. In these kind of phases, they reopen the all playgrounds and stadiums. So, and the next part is exercise and nutrition. So, all the athletes, those who are working at a moderate level, their immune system is good. Their immunity is good just because the athletes are aware about their diet, the balanced diet, the carbohydrate, the protein, as well as if they will incorporate some fresh seasonal fruits into it, the exercise, the carbohydrate and the protein, if you're taking in a balanced way, it will enhance the immunity of individual. So the athletes are having good immunity level. This is the basic reason. Next point is telemedicine. So telephonically you can in a video conference you can talk to the doctor, sports medicine doctor, who can advise you, understand your problem and can advise you properly what are the do's and the don'ts. You can talk to the doctor and take an advice for any kind of an injury or your sickness or anything you can discuss with the doctor online. Thank you very much.